Hi, so this is my exercise prescription project. My client's name is Renel Agatep. He's 22. He works as a patient transport. He lives an active lifestyle, and during the pre-fitness assessments, like the questionnaires, he did state that he has a 5 out of 10 motivation to change. His exercise goals that he stated during the SMART goal assessments mainly was to lose fat slowly and maintain strength. Risk analysis, he has no known signs or symptoms. His family, they seem healthy. He does live an active lifestyle. However, during pre-exercise tests, we took vitals, and he is a 230-pound guy, but he is 6'1", so his BMI comes out at 30.4. Using just common sense, even though he's categorized as obese, according to ACSM, in general BMI guidelines, he is, not the average body type. His resting heart rate is 76, resting blood pressure is 130, 74, standing 130, 76. According to the newest guidelines, American Heart Association, this categorizes him as stage 1 hypertension. The old blood pressure guidelines, he would just be pre-hypertensive. Um, to be categorized as this, it was either or. Renell is systolic, so that categorized him, even though his diastolic is under 80. His waist to hip ratio, 96.5 to 96.5, that sets him at a 1-to-1 ratio. So he's at high risk of abdominal obesity. His body comp from doing skin fold measurements, we did all 7 sites, and then we did the body density equation. He's at 1.05. His body fat percent after calculations is 22.5. That's his lean mass at 178.2, fat mass 51.8. Continuing on, we also did InBody and OMRON. They were similar. These were similar. InBody being on the lower end of the body fat, and of course the skin folds on the higher end. You can see there, InBody 16.8, and OMRON was 20. We did do the InBody earlier in the day, then the OMRON. The OMRON we did later after he worked out. I forgot when he hydrates. He does hydrate well. He drinks about a gallon a day of water, so I'm not sure when he has the greatest water intake. Continuing on, pre-exercise analysis, vitals, looking at his BP and heart rate. He's at 130, 74, 76 beats per minute. Body comp, from the skin folds, the InBody, and the OMRON. CDC states that a normal BMI is 18.5. ACSM, however, is anything greater than 22.4 is poor or high, poor health or high risk. The waist to hip ratio is 1, high risk for abdominal obesity. World Health Organization considers anything below zero point 0.9 to be healthy. Um, and according to the InBody, Riddell, he could benefit from decreasing his body fat by 4.9%. I mean, pounds, and increasing his muscle mass just by a little bit, 0.01 pounds. Looking at cardio tests, Renault did state that he didn't want to do cardio for the program design. He does like to do his own. He goes walking. He has a dog, so he does walk his dog by himself. But we ended up doing this, and then he let me know that he didn't want to do it. But we came to an agreement that we would a program format for cardio, but we wouldn't do any progression. So for the Gherkin treadmill test, we estimated his heart rate max at 198, his 85% at 180, and we reached his 85% about 4 minutes into the workout. Pretty close. It was about like 4 minutes and 32 seconds. We cooled him down for 1 minute, and his heart rate decreased to 168, and his post blood pressure is 130/76. From these results, we estimate his VO2 max to be about 50 and just at the cutoff. Um, so that sets him at the 80th percentile for his age group, 20 to 29. And he is considered a trained individual because of this, and likely so because he does exercise. He's a bigger guy, so yeah. And we also did muscular strength tests, estimated 1 rep max on the bench press and the leg press. On this day, we did weigh him. He weighed in at 230, and we estimated his 1 rep max for bench to be 231, and that's a 1-to-1 ratio. He achieved this after, or we calculated this after he did 185 for 8, and this sets him at the 40th percentile. For the leg press, we did 575 for 10, and for both, we could have done a few more reps if we would have struggled and broke form, but that would have been out of protocol, so we called the test off. His ratio for the leg press is 3.33, and that sets him at the top, 90th percentile. We also did muscular endurance. Oops, kind of cut off. His fitness level is excellent. He was able to perform all reps, max 15 reps for each of these exercises, um, easily. There was like little to no struggle when performing this. His form was on point, and it looked like child's play to him. So he does he does well with like lighter weight. This wasn't too much weight for him anyway. We also did flexibility. Renell did mention that he is aware of his lack of flexibility in his upper cross sectional area. So we did just the back scratch test. Um, and for his right over left, he got -4 inches. So that's how far his fists were away from each other. And for his left over right, 4.5 inches away from each other. So negatives right there. And there's no normative data for this for Renell's age group, mainly because when we do these tests, it's for the older pops. So for 20 to 29, or him being 22, yeah, no normative data. So continuing on to program design. So Renell wants to lose fat and maintain strength. Maintaining strength is dependent on losing fat. So I did take that into account, and then we did a 3 day a week split. Monday lower strength, Wednesday upper strength, and Friday is just total body endurance supersetting. And for the 4 week programming, it's maintaining strength. That's the idea of it, and high intensity. So the rationale behind choosing muscular strength is because um, this percent when we're max, and like this rep range, the volume and the intensity, according to just researches, it shows that it stimulates protein synthesis, not protein synthesis, muscular protein synthesis. Yeah, so continuing on, Renell doesn't want to do cardio, or he prefers not to do much cardio, but we did agree to program for it. So we programmed light cardio, just low intensity, no progressions or anything, and reflective of the Gherkin test, as I'll show you guys right now. Um, yeah, we focus on high intensity on compounds and accessory movements. He is almost a powerlifting type of person, weightlifting guy. So he did mention also that he prefers his compound movements. He mentioned the squats, the bench, the deadlift. That's why he does bend over rows, just the heavy lifting on barbell. So when I show you this, we can see the deadlift, the leg press, back squat, and barbell flat bench. We have incline press, dumbbell incline press, cable rows, lat rows. Just a lot of just a lot of basic exercise movements. We even use machines in here, abduction, adduction, just working in different planes of motion. These are the muscular strength days, and the rep zones: MS, muscular strength, muscular power. On Fridays, this is a little bit different. We did switch off every other week, so weeks 1 and 3 are similar. Weeks 2 and 4 are similar. We just changed a few exercises. Similar planes of motion, similar movements, just a little bit different. But then for the muscular strength days, week 1 and 2 are similar, and then week 3 and 4 changed up the core exercise. So instead of squatting first, we're deadlifting first, leg press in the middle, and then we changed from dumbbell incline bench to barbell incline bench. And we kept the accessories the same. And this is the cardio program I'm talking about. So for leg days, we did take into consideration that it is a leg day. So we did 10 minutes of treadmill instead of 15 on Wednesdays, which is upper body, and reflective of the Gherkin test, 4 miles per hour at 2% grade. Just keep his heart rate just a little bit up, but nothing too crazy. It's a light sweat. And coming back, so a summary, Renell, he is a trained client. He does know what he's doing. For the most part, he's intermediate in the gym setting as far as fitness. He does live an active lifestyle. He's been lifting for several months now, or years nonstop, at least 3 days a week, and his training sessions do last, at least an hour, if not 2 hours. His main goal is to lose fat and maintain strength is the second goal, which is dependent on the first. Overall, he's a good health status, regardless if he's categorized as obese, even though he's pre-hypertensive. According to the new ACSM guidelines, he's been doing it, and he's good to go. So why stop? For programming, we focus on muscular strength, and that's to stimulate, uh, muscle growth. It's the greatest magnitude or level of training intensity and volume to stimulate muscle growth, or it's just to maintain in his case. Muscular endurance exercises for total body workouts. That's to make up for the lack of cardio for programming in a way, just to counter that, and also just a little bit something different. You change up, like maybe muscle fiber types, um, lower rest intervals because he's the type to rest long and yeah. And so yeah, we already stated no progressive cardio programming. So yep, that is it for my